COVID-19 continues to be the largest challenge of our time, and we continue to adapt day by day to ongoing operations of government, ensuring that we are making changes that are appropriate to provide services for people, but also all the while looking at how we can improve the delivery of those services wherever people may live. Every community in BC is working hard to keep people healthy and safe. Our efforts to break the curve and to bend it to a place where we can start to reintegrate into a more normal way of life is just around the corner, but it is a way away. That doesn't mean we shouldn't stop looking at how we deliver those services. And people living in rural, remote, and Indigenous communities have unique challenges accessing the health care that they need. Many people who are sick have to travel for hours to see a doctor. COVID-19 is adding pressure to an overburdened system. When there's travel to urban centers to get care, there are also costs that go with that. Hospitals, sometimes airline flights, buses, cars, gas, expenses. That adds to the stress for families who are already dealing with a health emergency. Many Indigenous peoples aren't able to access culturally safe and appropriate care when they leave their communities and go to larger centers for acute care. Minister Dix and Minister Fraser have been working on delivering primary care in rural, remote, and Indigenous communities since the day we were sworn in as a government back in July of 2017. Because everyone in BC deserves to have health care services delivered close to where they live. And if we can't build the facilities in rural and remote communities, we should make sure we have the ability to take citizens to those facilities. And today, I'm announcing a new collaborative framework for health care in rural, remote, and Indigenous communities. This will help immediately in our response to COVID-19, but the building blocks of this primary care initiative started, as I said, 3 years ago, and we've been working on it ever since. The emergence of the pandemic only highlighted the importance of ensuring that we have in place programs and policies that will make all British Columbians equal when it comes to accessing their health care. So what do we do to provide better supports into the future? The framework includes improved medical transportation options, which includes planes, helicopters, and 55 new ambulances to bring people from remote communities into urban centers where they can get the health care that they need. People in rural, remote, and Indigenous communities won't have to worry about how they get there anymore, and that will relieve some of the burden emotionally as well as the burden financially. And we're committed to moving patients at a moment's notice, particularly at this difficult time of COVID-19. The framework also includes self-isolation accommodation close to hospitals, faster and culturally appropriate COVID-19 testing methods. And Dr. Bain Smith will talk about that, as will Susan Wanamaker. Also, an acceleration of enhanced virtual health care. We are making great strides in British Columbia, led largely by the private sector in partnership with our healthcare deliverers to make virtual healthcare a thing of our present, not just a thing of our future. It allows us to spread resources farther afield to make sure that people in every corner of British Columbia can get access to the quality physicians, nurse practitioners, and other healthcare providers here in BC. I want to say thank you, a huge thank you, to everyone who has worked on this, particularly Mr. Fraser and Minister Dix for making this a high priority for their ministries, but the First Nations Health Council, the Rural Coordination Centre of BC, our regional health authorities, particularly Northern Health, and of course the Provincial Health Services Authority, all working together with people on the ground, rural, remote, Indigenous, non-Indigenous communities. By continuing to work together, we'll be able to get through this particularly challenging time, and our healthcare delivery, our primary health system in British Columbia, will be the stronger for it. I've said many times that out of this crisis and out of this tragedy for many, many people, whether it be their businesses or their families or their communities, we will be invigorated. We will be stronger as a result of the efforts we're taking today. This is one of those steps. And I'll now pass the podium over to Minister Fraser for a few comments, and then we'll move over to Dr. Bain Smith for some of the details on the appropriate testing and other issues that she's been working on. Thank you very much.
The framework we are announcing today is important for all communities in rural and remote British Columbia settings. And I want to acknowledge that Indigenous communities, especially those in isolated areas, have unique needs and circumstances in the face of the pandemic. Ever since settlers began arriving here about 150 years ago, Indigenous peoples time and again, have been hit much harder by diseases and pandemics, and that has left lasting effects and fears. I've talked with many First Nations and Métis leaders in the past few weeks. They have shared their concerns about protecting elders, the knowledge keepers, and everyone in their communities, because many are vulnerable. They face challenges accessing health services, health conditions that put them at a higher risk, and often crowded housing situations in the communities. And I'm seeing how much we've learned. For Indigenous and all rural and remote communities, each one has unique needs, and help must be responsive to those needs. That is what this framework does. For many weeks now, we have been working across governments and across agencies to support Indigenous communities in their preparations. This is all hands on deck. And I'm seeing how much we've learned from working together on recent emergencies like wildfires and flooding. Our emergency response on COVID-19 has integrated First Nations and Métis like never before. It is about working together, government to government. And I want to take a moment to acknowledge the First Nations Health Authority and Indigenous Services Canada in this work. Their responsiveness and their dedication to safeguarding and supporting communities has been unwavering. Guidance with pandemic planning, critical supplies like personal protective equipment and food, coordinating staffing and training for health providers in communities, and of course funding. The measures in this new framework bolster the supports of all rural and remote communities, prioritizing rapid testing, accommodation where people can self-isolate both in community and in larger centres closer to hospital, and medical transport that will be there in their time of need. These are critical supports to all isolated communities in British Columbia. I will close by saying that I've heard enormous gratitude in my conversations and for the support for support from Indigenous leaders for the amazing work of Dr. Bonnie Henry, Minister Adrian Dix, and Danielle Bain-Smith, and everything they've been doing. And as they've been telling us, we must continue to abide by the measures like social distancing to slow the spread. We are flattening the curve in British Columbia, and though we have not seen significant outbreaks in rural and remote communities yet, we must be ready, we must be vigilant, and that's what this framework is all about. It helps us to do these things as we face this pandemic together. I would also now like to introduce Dr. Danielle Bain-Smith, our Deputy Provincial Health Minister of Indigenous Health, up to the podium to share some words of wisdom with you. Thank you very much.
I'm extremely grateful to be speaking to you today from the territories of the Lekwungen peoples. Our people have been healthy, balanced, and well for thousands of years. Since contact, we've shown our strength and resilience time and again against deliberate attacks on our ways of knowing and being, our culture, our language, the things that make us distinctly Indigenous. And we have faced ongoing systemic and structural racism and discrimination. As a result of colonial practices and policies, we come into this epidemic on unequal footing. An ethicist colleague of mine noted that coronavirus doesn't discriminate, but systems can and do. I believe that COVID-19 and our collective responses have the potential to promote equity rather than disparity if we come together with one heart and one mind with diverse Indigenous peoples. The work described here today is an excellent step in that direction. Earlier detection of cases with newer, faster testing and informed choices about access to higher levels of care will help decrease the impact of COVID-19, which, as noted by Minister Fraser, has the potential to be culturally devastating. Elders are the heartbeat of our community. They're our link to our ancestors, our teachings, and we need them to ensure cultural continuity. In addition to this great work, there are 3 other considerations that must be hardwired into our responses if we want to achieve equity. The first is that we must use distinctions-based approaches that honor the unique and diverse experiences amongst Indigenous peoples. Recognizing that First Nations, Métis, those living in rural, remote, and urban areas are different from each other and bring different perspectives and needs. Secondly, we need to hear and respond to the stories and needs of Indigenous women and girls, who we know as a result of the Missing and Murdered Indigenous Women Girls report face higher rates of violence, which have only intensified during this stressful time of self-isolation. And finally, we need to use robust tracking using both Western and Indigenous data to illuminate whether COVID-19 responses are meeting the needs of Indigenous peoples in culturally safe ways. By this, I mean it's not just about the services we deliver, it's about how we deliver them. As healthcare providers, we need to be aware and respectful of the uniqueness of BC's diverse Indigenous people. Cultural identity is fundamental to our health and wellness, and it must be respected. In collaboration with First Nations Health Authority, Métis Nation BC, and BC Association of Aboriginal Friendship Centres, and others, our office is working to uphold Indigenous data governance principles and help create a clear picture of how COVID-19 is impacting Indigenous peoples in BC. I've been truly awestruck by the collaboration and relationship building that's taken place over the last number of weeks. During this unprecedented time, there are unprecedented opportunities to advance reconciliation and Indigenous self-determination. I'm hopeful that on the other side of this crisis, we can tell a story of how we came together in meaningful partnership with diverse Indigenous peoples to ensure equity, decolonization, and cultural safety. Masi Cho. I would like to now introduce Susan Wanamaker, Executive Vice President, Clinical Service Delivery with Provincial Health Services Authority.
As I'm joining today's event from downtown Vancouver, I would also like to start by acknowledging that I'm privileged to be presenting on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm delighted to be part of this announcement today. For the work we are announcing, for the meaningful collaboration it represents, and for the meaningful access to care this means for people living in rural, remote, and Indigenous communities. Throughout my healthcare career, I've been privileged to work with different healthcare providers across the province, and I've seen and experienced the impact of timely access to care at every stage of the patient's journey. There's no denying that when it comes to access to care and access to critical care, be it related to COVID-19 or other life-threatening situations, that minutes count. And not just for our patients, but for our care providers themselves, who understand that the positive impact they might have on someone's life often increases the sooner the patient's transportation can be merged with the care at hand. As we've heard, we are managing in a new reality in the midst of COVID-19, and this has sparked forward momentum on much-needed transportation resources that will serve our patients both short and long term. As Premier Horgan has already shared, today's announcement involves a number of tangible service improvements for British Columbians living in rural and remote communities. With respect to BC Emergency Health Services, this involves significant additional resources for our transport fleet, including 55 additional ground ambulances across the province, and to highlight, 5 of those will be put into the Northern Health Authority, and 5 additional provincial air resources, both fixed wing and rotary, with others as we need. Initially, this expanded network was activated as part of the COVID-19 surge planning, enabling and supporting the swift connection of people living in rural and remote to higher levels of care. But thanks to thoughtful, evidence-based planning with partners across the province, these resources will remain in place long-term, ready for repositioning as required to meet local needs. PHSA and BCEHS are excited to be working as part of this partnership with the BC government, with our regional health authorities, with the First Nations health authorities, and our Indigenous leaders across the province. As we shift from surge service delivery to implementation of long-term resources, we are actively moving on the next steps. This includes continued engagement and collaboration with the health authorities, First Nation health authorities, and our other Indigenous partners. Human resource planning and implementation is critical, as is engagement with our union partner QP 873 as a key component of this. Our team is truly excited at what this announcement means for rural and remote communities, our patients and families, and our paramedics. In closing, I'm mindful of a well-known African proverb that rings true today. If you want to go fast, go alone. If you want to go far, go together. Arguably, we are also moving fast in light of COVID-19, but the partnership behind today's announcement means our expansion of BCEHS services will be impactful and lasting. Finally, I'd like to thank the government, the Ministry of Health, for your leadership on this. And I would also like to offer my sincere appreciation to everyone who's been involved and look forward to working together.